This is Chris K with your Peak Fitness Posture Fix of the Week. Now, with the early months of the year, one of the main activities for weight loss and getting active is either running or involves running. And really, this post this week goes out to all of the people that we've seen recently with groin pain, with issues kind of in the front of their hip, that are doing hip flexor stretches, stretching their quads, stretching all these areas out and really getting nowhere. You know, in some cases, doing this really exacerbates the problem, so it gets worse. And really my answer to that is, really in the majority of the people that we've assessed, the problem is quite the opposite. It's a phenomenon known as butt gripping. And basically what that means is, because the posterior structures of our hips, you know, the deep hip external rotators, so piriformis, you know, all of those in there are tight, it doesn't allow the femoral head, or kind of the bone that is the kind of the top of the leg here, to glide back and forth. Because it has nowhere to go when we're walking and running, it jams up in the front of the hip and really can cause some nastiness there. And really a way to check that is to just check hip internal and external rotation. In order to do so, what I'm going to do here is just get on my back. All right, I'm going to straighten one leg out, and what I'm going to try to do is internally rotate or externally rotate my hip as much as I can by bringing it in this way. All right, in an ideal situation, we want around 90 degrees of hip to external rotation. So that's like parallel to my kneecap here. I've got about maybe 75%. What I've been seeing recently is around 50 to 60%. When it's over here, you know that you're very restricted. To confirm that, what we can do is roll onto your back, externally rotate by trying to bring my knee or bring the leg onto the other leg here, and just see how far it can get. If you're up here, or you find that there's kind of a gap between your leg and your other leg, or your up leg there, you've got a problem. All right, with that said, the solution begins with a tennis ball. And what I'm going to do here is I'm just going to place the ball down here, and I'm going to find my piriformis and kind of the deep and external rotator. So we're looking here around the upper butt cheek. What I'm going to do is just sit on it. So I'm placing it under this area, and I'm just trying to find that spot. I'm finding a spot of tension, of just kind of the buildup or the tightness that exists there, any restrictions that exist. And what I'm trying to do is just let the ball sink into my hip, just like a telephone pole sinking into mud. What I'm trying to do is just relax onto this, take deep breaths, tell my body to neurologically release this area, and just spend about 2 to 3 minutes here, just telling the muscle to quiet down, to loosen the grip and to release. Once that is the case, what we can do is incorporate what is called a pigeon position, or a hip external rotator stretch. I like to use this position because it's also good to breathe deeply in. I'm just going to cross my leg in front here. I want to rotate my back foot to the floor. I'm just going to hold in this position and just breathe deep. Just think about filling your rib cage, expanding out, just holding in this position. You can reach forward and lean down to kind of intensify the stretch. And what I like to do is just rock back and forth, really help to centrate the hip, kind of move around in the capsule. Again, for anywhere from 2 to 3 minutes. From there, our last activity would be what is called a rock back exercise. All right, so we've released the muscle, we've told the muscle to lengthen. Now what we want to do is center the femoral head, or kind of center the head of the hip bone back into its socket. So what we're going to do, I want you to find a slight arch in your back, just rock back on your heels. Think about just sitting into your heels, releasing that position, and coming forward. I'm just thinking about relaxing, kind of just letting my hip bones sink, or my hips sink into my feet here. And I'm just repeating this about 10 times. Alright, so we have release, relax, and then mobilize. And really with that, that'll help to bring everything back into position. It'll just help the joint to track a little bit better. And doing this on a daily basis over several days or weeks will really help to just release those areas. The other thing that you can do is when you're sitting down, just think about keeping everything straight. So usually when we sit down, what tends to happen is we'll shift to one side, and that side is the side that is gripping. So what we want to do is just periodically check that position. What I can do is just kind of shift on my other side, just kind of relax, grab my butt cheek a little bit, relax it, release it, and then just try to center my weight between my two hip bones. Ideally, I'm symmetrical up and down, and just relax. Get up every 10 to 20 minutes, let things release, and just sit back down, make sure things are centrated, and just be conscious of that position to kind of just make sure that we take care of the environmental situation that causes that. Do your daily postural practice, and your groin and running pain will be a thing of the past. And that's your Peak Fitness Postural Fix of the Week.